Introduction. When research is performed in any field, scientists must develop a conceptual framework for their studies to have a clear vision for themselves and articulate it to others. It is built prior to the experimental part to help researchers answer specific questions. However, to develop the conceptual framework, it is crucial to define the concept, constructs, and variables and understand their similarities, differences, and application in healthcare research. These three terms are essential for studies since they help operationalize and conceptualize measures. Discussion. The three foundational aspects of a theory are concepts, constructs, and variables. A concept can be defined as a phenomenon that serves as a building block for developing hypotheses in research. A construct, which can be unidimensional or multidimensional, is an abstract idea used for explaining various events. To elucidate the above-mentioned terms, variables are used, which are measurable characteristics of constructs that can be dependent, independent, moderating, and controlling. For example, a person's weight is a concept, while one's body mass index is a multidimensional construct that comprises a specific ratio of weight to height squared. In the last case, height and weight are variables used to measure the indicated construct. As incomparable as they may seem, these three terms have some similarities. Indeed, unidimensional constructs and concepts represent one specific abstract idea. For instance, gravitation is a concept, but it can also be viewed as a construct since it explains the phenomenon of objects staying on the ground on Earth. Moreover, concepts and variables are similar in the way that they represent one particular idea or measure. The concept, variable, and construct differ from each other in several dimensions. Firstly, a concept is always one idea, while a construct can incorporate multiple abstractions. Furthermore, the distinction between construct and variable is that the former cannot be directly measured while the latter is purposefully used for measuring constructs. The difference between concept and variable is in their purpose. The latter serves as a measure, whereas the former represents a phenomenon. The ultimate goal of these three conceptions is to operationalize and explain a variety of healthcare measures. For example, describing healthcare workers' satisfaction, engagement, motivation, and burnout is conceptualized as job morale to simplify research in that field. It is sometimes challenging to explain such phenomenon as public health acceptance, hence, researchers formulate the construct of acceptability of medical interventions to be able to qualitatively or quantitatively measure it. In fact, statistical tools like logistic regression analysis are frequently used to determine the association between independent and dependent variables that constitute a health-related construct. As these examples demonstrate, the three terms under discussion can be utilized in multiple ways to understand an idea or test a theory in healthcare research. In summary, variables, concepts, and constructs are essential elements of scientific studies that allow the development of a theoretical framework and produce a measurable outcome. Indeed, concepts and constructs represent one or several abstract ideas that may explain a specific event or phenomenon. These ideas are usually measured with the help of variables that may be constant or dynamic. Overall, all three terms are crucial for healthcare research since they are implemented in measuring and elucidating certain behaviors and attitudes of people regarding public health. Conclusion. Measurement in healthcare research can be done in various ways, but it requires a clear definition of variables. Indeed, defining measures is critical for developing a robust method section and attaining the study objectives. For example, the outcomes research may measure morbidity and mortality after a specific surgical procedure or therapeutic intervention. However, not all phenomena can easily be measured, hence, operationalization, the process of translating abstract ideas into measurable components, is required. The measurement process involves determining the level of variable assessment, which can be nominal, ordinal, interval, and ratio. This and many other essays are available at studycorgi.com.